Okay, so what we are going to look at is how you get the most out of the uh, Easy Plus cone beam CT planning software for dental implant cases. If you place the CD that you've been given by Dental Scanning Services into your CD drive, it should auto load. If for any reason it doesn't auto load, go to My Computer, click on the CD icon, and you will see data like this open up. And if you double click on the Launch exe program, the program will load up. And what you will see is you will see the information pertaining to your particular case. Now I've anonymized this particular case, but this is what you will see. 4 screens: coronal, sagittal, axial, and 3-dimensional. The 3-dimensional view often comes up with a fuzzy brown appearance like this, and this is really because it's in between scales, between soft tissue, pixelation, and bone. And we need to clean up this image first of all so you can see what you're looking at. If you go to the toolbar at the top, you'll see a button here which says Fine Tuning. Click on it once and you'll see Colouring and Windowing. You click on Colouring once and you'll notice now down here at the bottom a toolbar has come up, and you'll see a pyramidal type structure. It's not really pyramidal, but structure here, and you place your mouse in the midpoint of this structure. Hold the left mouse button down, and as you slide it to the right, it denudes the facial skeleton of skin. If you go to the left, you can see that we actually end up with a fairly clear picture of the patient's soft tissues. Now, for the purposes of this exercise, you want to clean up the image so that you can see majority no skin and mostly dental tissues. If you play around with these buttons, and it really is a matter of playing around, if you move them around, you alter the sharpness and weightness of the dental tissues accordingly. And if I want to make any of the, and when I finish this, I click on Exit, and we come out of it. If I want to make any of these boxes bigger, you'll see that there's a little slanted arrow box in each of these areas as you fall over it. If you click on any of these, you'll find that this then makes the image become the primary image. And to rotate the image, you hold the right mouse button down. If you want to make the image smaller, you click back on the same arrow. You can see them up here on the top right hand side. Click on it and you're back to the main screen. Now in this situation, what we're going to do is we're going to take a look at the possibility of placing an implant in the lower jaw. So what you do is you turn the 3D skull image to a side-on profile so that the ascending ramus are superimposed. So you're getting a true side view. The green line here corresponds to the green line up here, which is the horizontal, or axial in this situation, line. And if you go to the end of the line, you'll see that we've created in the sagittal section a little central pole with 2 curved arrows around it. And if you hold your left mouse button down on this green line and you move it, you'll see that in all the other images, whether it's 3D, axial, or coronal, the image changes according to the slice that you're taking it through. As a rule of thumb, it's always a good idea to put the horizontal line parallel to the area in which you're thinking of placing the implant. And then secondarily look at the coronal line. The coronal line here, this yellow line, refers to the slice which is the coronal slice, which you see at the top left hand side. So if I put the mouse over the midpoint and you see 2 crossing arrow lines appear, and I hold my left mouse button down, as I move back and forth, and you look at the coronal section on top left, you can see I'm moving through from the back of the jaw now, coming forward. You can see the back of the maxilla, the back of the jaw, we come up to the anterior portion, so it's premaxilla and the mentalis area on the mandible. So let's just, for the sake of this exercise, say we're looking at placing an implant in the lower left first molar region, which is approximately here. If I take the axial view at the end and I line the coronal view at the end, I line it up approximately over the midpoint of that molar tooth. Now what I need to do is I need to be able to create a panoramic view. So if I go back to the sagittal section and I bring the sagittal section down, you will see now over here, if you keep an eye on this axial section as I move up and down, you'll see how I'm at the level of the teeth. I'm coming down through the body of the teeth, top of the alveolar process, into the body of the mandible. And you can do it by moving this line up and down over here by holding the left mouse button down, or you can put the cursor over the axial section and use the scroll button on your mouse to go up and down. This is probably an easier way of doing it. What I tend to do is I tend to scroll down until I can see one of the mental foramina notches, which if you look on the 3D view is about here. And that's quite a good position to be able to create the panoramic curve. So what we need to do is create a panoramic slice in this area. To do that, we go to the toolbar at the top which says panoramic curve. We click on that once. We then click on manual once, and you will see now that the arrow has changed, and beneath it there's a little dome shaped white curve with some red lines on it. If you proceed to the back of the jaw and make a single click, move through the midpoint of the jaw, make another single click, keep coming round, a single click each time, down the midpoint until you get to the end of the section you want to look at, and you double click. And when you double click, you get a panoramic view, which is exactly the slice that you've asked for when you made the original clicks in the axial view. And if you put your mouse over what is now the panoramic view and use the scroll button, you are now scrolling through the tissues. So what I'm doing is, if you look at the axial view, top right hand side, you'll see that the sectional view I'm looking at now is outside the tissues. Then I come into the tissues, and you will just see, if you look, this slice is what we're looking at in the panoramic. You'll see the mental foramen here on the outer aspect of the jaw. As I continue to scroll through, you begin to see the definition of the inferior dental nerve. You continue to scroll through until you're out through the lingual tissues, which you can see on the axial view up here. So I'll bring it back to the line we actually originally made in sectional view. Now this is still a little bit fuzzy. So whilst you're in the panoramic view, right click and set the thickness at 0.5 millimeter, and you watch the image carefully. The image quality will change. So you got a increased definition because the slice is now 0.5 millimeter thick, not 2 millimeters thick. What I tend also to do is set the interval to about 0.5. It doesn't make a lot of difference, just makes for slightly greater accuracy. Now again, it can still be argued that this image can be sharpened up a little bit more. To do this, if you go to the left hand toolbar, you'll see a button called Apply Filter. Click on Apply Filter and click on 2D Sharpen, and watch what happens to the image as I press this. You get a much nicer, grainier sharpness. Okay, so you'll see that there's an orange line passing through the panoramic curve, and if I scroll back and forth and we move through the planes, it stays there. The orange line relates to the orange box which is available up in the sectional view. Now when I'm planning an implant case, I tend to only want to look at one box at a time. To highlight one box, you double click on it and you have the one box, and that box relates to the orange line. If I want to see more than one box, I go to a little grid at the top here, which is the second button in from the right hand side. Click on it and it says how many boxes do you want to see. So if I wanted to see 4 boxes, I'd highlight 4 boxes, I'd click on 4, and now I have 4 boxes, with the one with the orange line round it being the one that corresponds to the exact point, and the others are either side, identified by their measurements. As I said, I prefer to work with one box, so I double click on the one and we're back again. Okay, so we need to evaluate the bone under the first molar position here. So if you place the mouse over the orange line, press down with your mouse button and drag it to the midpoint of the tooth. We can see the approximate bone in this area. If you don't want to move the cursor by highlighting it, if you place your mouse over the sectional view and simply use the scrolling button, you can see that we're moving through the tissues back and forth. So you can use either the scrolling function here, or you can take hold of the line. Okay, now we've got to identify important anatomical structures. The most important in the lower jaw is the inferior dental nerve, the mental foramina, and the incisive nerve. So the best thing to do there is to paint them onto the image so that you can see clearly where they are. To do this, what we need to do is firstly scroll on the panoramic curve so we're coming to the outside of the bone. You can see on the axial view on top right, see where the blue line is now. If I come back to the panoramic and I scroll, you will see the mental foramen here and the edge of the mental foramen here. On the left hand side here, scroll a little bit, on the right hand side here. Okay, so the first thing we need, and of course the mental nerve travels, or the inferior dental nerve travels from the lingual aspect, passes through the lingula on the lingual aspect of the mandible, coming forward on the lingual aspect, approximately the midpoint of the first molar. It then swings across the body of the mandible, travels more buccally until it exits out of the mental foramen. And of course, as you are well aware, there is always an anterior loop on this which comes forward past the mental foramen more anteriorly, and often again in about 30% of cases an incisive nerve which travels as a branch from this loop further forward again, so, and sometimes can travel from one side of the jaw to the other. So it's very important that this is mapped out so that the implant is not placed through the incisive nerve. So, painting the nerve onto this. If we go to the toolbar at the top, you will see 3 teeth with a red line underneath, and when you sit over it, it says Draw Canal. Click on it once, click on Manual, and you'll see now that you've got a little red line with 3 white dots, and this allows you to paint the nerve on. So, now you've done as planned, you've positioned the panoramic slice at the most buccal aspect of the mandible by scrolling it previously. So you can see the mental foramen here. Sit over the midpoint of the mental foramen and click only once. Okay, and so you're in the midpoint. You can just see it's picked up here. As you scroll, you will see the nerve is picked out here and here. Now if you want to make life easier, if you enlarge the image, you have a better view. So you can see over here, this is the mental foramen where you clicked, but what you really want to do is come forward, because that's what the nerve is doing. That's about as far forward as it comes, and then go back and map out the nerve along the position of the ID. And when you get to the end of the inferior dental nerve, double click. If you minimize, you will see, if we enlarge the 3D model, pressing the right button down, you will see that we have now mapped the approximate position of the ID nerve onto the 3D model. That's quite good for being able to discuss with patients where the nerves run. What we need to do now is check that we've got that right. So I'm now going to scroll forward. So you see the orange line has moved forward. As I said, I can either move it back and forth like so, or I can sit over the sectional section and scroll back and forth. And you will see that where the red line is, this will show up on the sectional view because it's reproduced in all images. So you can see here is where it exits. If I come forward a bit, so this is the small incisive branch. You have to be careful about this when you come where you think you're safe, mesial to the position of the fore, but actually it can run sometimes all the way through to, as I said, the other side of the jaw, and commonly to the mesial aspect of the roots of canine teeth. So you just have to be careful. As I scroll through, you can check, make sure that you're within the confines of the nerve canal, and that looks pretty good as we scroll backwards. If you find that you want to edit an area, if you just go to the 3D view, just click on the line, you can see the lines come up, and you can move the positions by holding the left mouse button down, up and down. You can also do that in the sectional view, though that takes a bit of practice. So now we're reasonably happy we've got the inferior dental nerve mapped out on the implant, mapped out on the jaw rather. So I now move the sectional slice to the midpoint of the first molar tooth where we're thinking of placing the implant. These are 0.5 millimeter sections. Okay, so I'm looking at the bone in this approximate area here. So, how do we assess this for suitability for an implant? Well, you have a ruler on the top left hand side. You click on the ruler and click on 2D. You can measure the width of the bone. Just bear in mind, when you're measuring the width of the bone, the average implant on the market is around 4 millimeters in diameter. You need 1 millimeter either side. So in this situation, if you're going to use a 4 millimeter diameter implant, you need a minimum of 6 millimeters of bone to allow for 1 millimeter buccally and lingually. That sometimes gets forgotten, but you just need to have a look at that. So that's, you take an approximate measurement like so. You take the length again, click on 2D, and you select to a point that you're comfortable with. So in this situation, in the molar position, you can put a standard implant up to 15 millimeters. I always give it a wide berth. Because you can often have small nerve fibers lying around. So this is a 14.9. So in reality, with modern implants these days, you can use anything from a 10, 12, 13, 14 millimeter implant, and you can feel very comfortable here. You've also got the ability within the framework of the software to superimpose an implant in this site. So I'll show you how to do that now. To get rid of these measurements, right click, press delete, and again we'll right click, press delete, and you have a button at the top here which says implant. If you click on implant and you want to insert a single implant, click on it. You select the type of implant that you want to use. So let's say I'm picking up a standard Straumann implant, and I'm going to use, let's have a look, let's say we're going to use a 4.8 12. I'll just click on it, click on insert, and then you'll see that as I'm moving the cursor around, it's turned into an implant. If I then put it into the approximate position I want, it then superimposes the implant into the position that I am looking to place the implant, and you can correct the angles in both planes. So that again gives you an idea, and moreover also gives the patient an idea of what you would be looking to achieve. And again, this is now superimposed on the model. I've got the density on this model down as low. On some of these, you get the information relating to the implant come up, and that can be a bit irritating. So if you click on the number, that goes away. So if you're trying to describe to the patient the position of the implant, this would be it. Now during this conversation, of course, I've described this as a lower molar, but actually isn't the lower molar at all. It's the lower first premolar. But we've covered off what we need to cover off, and if we look all the way around, we can see that if we place a 12mm implant in that situation, we are not going to hit any important structures. So we can feel reasonably comfortable looking at that. I don't think I'd have gone to a 14. That's obviously personal preference. Be a bit close for my liking. So that just about covers the lower mandible in this first and basic tutorial. I think the last thing we should just cover is how you might assess bone density in an area if you're thinking about placing an immediate implant. Now, cone beam CT does not give you Hounsfield units, but it gives you a grid scale which is close to. And in my experience, and I've been using this software about 5 years, and I've been placing implants for 26 years, it's proven to be a pretty reliable measure. I'd just like to describe that to you. So if you look at the sectional view of an area you wish to assess, if you go to the top, you have a profile button, which is 1, 2, 3, 4. It's the 5th button in from the left. If you click on the profile button, you get a little sort of almost like a Bupa heartbeat box by the cursor. Just sit just outside of the bone area that you're looking at, make a single click, drag the line through and make a single click on the other side, and you will see that you get a profile histogram. And the histogram relates to the outside. So this little bit here relates to the soft tissues with a very low measurement. As you pass through, you have the increase in density, which is the cortical buccal plate, which gives you a value of 2,419 or 2,500 according to this. You then move through the cortical plate, through, down into the cancellus, which is fairly soft here. It's got a Hounsfield measurement density, which is very low here at about 236. Correction, it's not a Hounsfield measurement, it's an approximate measurement. If you then pass all the way through up to the lingual plate, you have a measurement of 1,578, and then you tail off into the soft tissues. Now this is relevant in planning your case, because if you're going to place immediate implants and you're going to place a provisional restoration immediately on the implant, you really need a measurement of 800 or greater, otherwise I wouldn't advise it. However, if you get experienced in using this software, you can also look at bicortex or bicortical fixation. Now, in that situation, if you wanted to place an immediate in this lower jaw, and as I say, I personally wouldn't do that, but everyone, each to their own, you really would be wanting to place an implant which is wide enough to engage from somewhere over here to somewhere over here. So you need to assess the width of that. So if we just go to engagement point here, and that is at approximately, I don't know, roughly 6 millimeters down on this scale. And we come over to here, and this is roughly, let's say, 14. So 6 from 14 is 9. Would mean you'd need to place a 9 millimeter wide implant in here to get bicortical fixation. Now, to the best of my knowledge, they don't exist. So The net conclusion from this is that you'd place an implant. You may well place a healing cap rather than submerging it, but you wouldn't place an immediately loaded implant. This information is quite useful, particularly when assessing immediate cases for patients who are applying pressure to have immediate restorations. Because in my experience, if you place anything and place the restoration over it, even if it's out of the occlusion, in anything less than 800 units on this scale, you run a very high risk of non-integration. Okay, so we'll call it an end there, and in the second video we will look at assessment of the maxilla and the sinus area